Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. Iyyaka na'budu wa iyyaka nasta'in. Dr. Ghazal Iqbal. I'm working as a pulmonologist, and today I'm giving a presentation is how to face novel coronavirus during epidemic. Okay, so when I started that presentation, I thought the enemy were at the gates, but I think the enemy has crossed the gate now. So that was the caption, just to explain it. So just a little while for a background. The new name is 2019 nCoV or SARS-CoV-2 is a highly contagious, and mode of transmission dynamic is still unknown. So we still don't know whether this is a droplet infection or the close contact. So dynamic is still unknown. Sustained person-to-person transmission resulting in deaths, and that's why it was categorized as pandemic, and it's still very sustained. So what were the basic symptoms, presentations? They can present with myalgia and fatigue, which is present in 44% of the patient. They can present with headache. They can present with hemoptysis, 3%. They can present with diarrhea, 3%. And they can also present with lymphopenia, 3%. And abnormal CT chest was in 100% of the patient. Most common symptoms were fever, cough, and the generalized malaise. I'm talking about the Wuhan hospital's complications rate. What they developed was ARDS, which was present in 29%, anemia, 15%, acute cardiac injuries, 12%. So these patients who were critical, admitted in ICU, ventilated, later on they showed cardiac complications in the form of acute cardiac injuries, which is type 2 MI. They showed increase in troponin levels, and they behave like acute coronary syndrome. Most of them admitted in 32% of these patients, where they were mechanically ventilated or treated with high flow nasal oxygen. 15% died of those critical patients, and hospital acquired infection were noted in 13.5%. So what treatment they offered there? Most of the patients were treated with high flow nasal oxygen, 71% of the patients. Mechanical ventilation was done in 11.5%. Prone position ventilation was done in 11.5%. ECMO 11.5%. Renal replacement therapy, as we know that one of the acute renal failure is one of the complications, was done in 17%. Vasoconstrictive agent in 35%, the patient who showed septic shock. Antiviral therapy in only 44%. And what they did, because we don't have anti-coronavirus therapy, what they did, they used for flu vaccination, ganciclovir and lopinavir. Antibacterial agents were used in 95% of the patients, because these patients were very critically ill, mechanically ventilated. We never know what other comorbids were present, so they were given in 95% of the patients. And glucocorticoids were only given in 58% of patients, but I'm talking about those critically ill patients. Infection prevention and control measures. So give suspected patient a medical mask, not us, and direct the patient to a separate area. So we need our isolation area somewhere in ER or somewhere in OPD. I think ER would be a better idea. And always use PPE, which includes medical mask, eye protection, gloves and gowns in suspected patients. Healthcare should refrain from touching their eyes, nose and mouth from contaminated hands and gloves. This is very, very important, because we still don't know what's the mode of transmission. Always do collect blood cultures on all these patients. Now collect specimen for both upper and lower respiratory tract. Lower respiratory tract mostly in patients who are ventilated, not in everyone. So upper is essential, and send it for 2019 nCoV by real-time PCR. And in other patients we were not able to do, then we do serology, which is not still confirmed.